Today, we'll be looking at dyslexia, a disorder that affects 10% of the population. After an interview with Dr. Sylvia Paraccini, we have a better idea of how it works, and we hope to pass this information on to you, the valued listener. Dyslexia is a neurodevelopmental disorder affecting a person's reading and writing. More precisely, it's a localized weakness in the phonologic module. After interviewing Dr. Paraccini, dyslexia's relationship with handedness and its origins in genetics is more deeply understood.
Dr. Paraccini graduated in biological sciences from the University of Pavia, and then obtained a DPhil in human genetics from Oxford University in 2003. Since 2011, she has worked here in St Andrews. Dr. Paraccini is a biological geneticist with a particular interest in the workings of the human brain. This made dyslexia a perfect research project for her, as it shows perfectly how small genetic variations can lead to complex trait changes.
Dyslexia's relationship to genes is known as its irritability. Dr. Paraccini explained that the irritability of dyslexia was between 40 and 70%. A range of genes contribute to the disorder, yet genes are not solely responsible. Environmental interactions such as education and parenting also have an impact.
Recent findings by Dr. Paraccini and other researchers have suggested a link between dyslexia and chromosome 15. Screenings have found a deletion of this particular chromosome in dyslexia patients. Dr. Paraccini's research into chromosome 15 has suggested that the loci determines whether a patient has dyslexia or also conditions such as Prader-Willi syndrome. This is one of her more recent topics of research.
When asked about future research, Dr. Paraccini was keen to mention dyslexia's link to handedness. If neither your left or right hand is predominant, you are more likely to be dyslexic. Dr. Paraccini will look specifically at these traits in children and believes that whilst there is a connection between handedness and dyslexia, it is a very complex association.
Dyslexia is difficult to define, and there is no quantitative measure to determine its severity, hence why it is all too often seen as having a low IQ. Dr. Paraccini was quick to dismiss this belief and explain that there is no connection between dyslexia and a low IQ. In fact, Albert Einstein, Bill Gates, Richard Yarrow and Muhammad Ali all suffer from dyslexia. We hope that you have enjoyed our journey through the ins and outs of dyslexia. See you soon.